My dear friends, we are discussing Mullerian abnormalities, and in that we had discussed that the commonest uterine or the Mullerian abnormality is the uterine septum, wherein the uterus is divided into two parts because of a partition inside the uterus. Now the partition can be of different sizes and shapes. Depending on the length of the septum, it is divided into different categories. One is one which lies partially inside the uterine cavity, maybe occupying about half, 1/4, 3/4 of the uterine cavity, and that is called as a subseptate uterus. When it extends right up to the internal os, or the part where the uterine cavity joins the cervix, it is called as a complete uterine septum. When it extends into the cervical canal, it is called as a uterocervical septum, and when it extends into the vagina, it is called as the uterocervicovaginal septum. And a little bit of controversy in this is the presence of a small dimple at the fundus, which is very common in fact. So we don't know whether to call it a septum or not. So it is often labeled as an arcuate uterus because majority of the studies show that it is not, it's a benign condition, does not seem to affect the pregnancy outcome in any way. So what does a septum do? What are the risks associated with the septum? Interestingly, majority of the women with a uterine septum will have a normal pregnancy. The only thing is they may have what is called as a malpresentation. That is, instead of the baby being lying vertically and head down, it may be transverse and breech, or the buttocks are down, or oblique presentation of the baby because of the intervening septum. There is increased risk of cesarean because of these malpresentations naturally, and sometimes some studies do claim that the labor does not proceed normally in this uteri. However, if you compare to a general population, there is an increased risk of miscarriage in these women. So the incidence of miscarriage varies depending on the size of the septum, thickness of the septum, the amount of blood supply to the septum. So it may vary in studies from 10-20% to 50-70%. So it's extremely variable. However, you have to understand that even after 3 miscarriages in a woman, with 3 miscarriages, 65% of babies, there is still a 65% chance of having a normal pregnancy subsequently. We always talk in percentages. In medicine, we always talk in percentages. But compared to a general population, as I said, there is an increased risk of miscarriage in these women. Typically, this miscarriage occurs between 3 to 5 months of pregnancy. Although some new studies are showing that it can occur towards the end of the 2nd and the 3rd month also. There is a higher risk of preterm labor or premature delivery of the baby in these women, and maybe again, we are not very sure about this. Again, each patient has to be individualized. There may be increased risk of weakness of the cervix, also called as cervical incompetence, which will lead to premature labor and sometimes what is called as a 2nd trimester abortion, that is between 3 and 5 months. Apart from this, there are studies which claim that the septum may cause infertility, but again, that is very controversial. There is no clear evidence in this regard. So the next question arises in our mind is, when do we treat a patient having a uterine septum? That's for our next discussion.